Thank you for staying with us, and a warm welcome to those who've just joined us. This is All Angles on ENCA. Now, this coming Wednesday, the Minister of Finance, Heal'a.Coalition, will present the budget allocation for 2024 to Parliament in Cape Town's City Hall. The Healthy Living Alliance is calling on the Finance Minister to increase the Health Promotion Levy to the World Health Organization's recommendation of 20% to ensure that all South Africans, particularly the most vulnerable, realize their right to nutritious food. Now, research shows that nearly 4 million South African children live below the poverty line. For more, I'm joined now by the Interim CEO at Healthy Living Alliance, Nzama Mbalati. Mr. Mbalati, thank you very much for your time here on ENCA. Just explain to us what the increase to the Health Promotion Levy to the World Health Organization's recommendation of 20% would help with in our context.
Thank you for having us, and good afternoon to the viewers. So the most critical thing in the taxation of unhealthy products, so this applies the same way we're talking about the sugary drinks tax or health promotion levy, applies to unhealthy products such as tobacco and alcohol. It's in terms of harm reduction and reducing consumption. So when you increase the prices of unhealthy products, you are deterring people, particularly people on the lower strata of the economy, the working and the poor, from easily accessing these unhealthy products. Because if you see the sugary drinks, including your energy drinks, are the kind of drinks that are easily available and accessible, sometimes to a price of 10 rand. So this makes it much more easier in communities. If you look at communities where I also come from Giyani, where access to water is a big problem. So people refuse to over-consumption of sugary drinks. So an elastic increase in the price cap of this make sure that people move away into healthier options. So I think the most important thing that we've been calling for, although Treasury thinks it's not a good public finance policy, is to make sure that this money that you collect, the revenue that you collect from this unhealthy product, help people to afford, healthier food.
And I mean, looking at it, in 2018, it was put up at around 10%, and you want it to be put at around 20%. But what about the children's support grant? Because some people would say that also doesn't help parents afford healthy food for their children. So they'll always run off to the unhealthy food because that, for some reason, is more affordable in South Africa.
Right. So we know that data is telling us that people purchase and eat food based on availability, accessibility, and affordability. So it's very true. So we know the food poverty line, according to Stats SA, is at around 540. Currently, the child support grant falls short, to support households and mothers and caregivers to actually buy nutritious food for their children. So one of the things we've been calling for is you can use these health taxes to actually soft ring fence and actually make sure that they are dedicated to address the social protection for food poverty line, and also to look at it as a safety net for most South Africans who are currently unemployed. If you look at young people, if you look at women, majority of the people are actually unemployed. So it is important that we can earmark these interventions such as the health promotion levy, that it's stronger, but you also look at allocating those funds to mitigate and make sure that it looks at addressing issues of people affording, to purchase food and healthy food in particular. So we think this is like a win-win situation, and actually it's a simple formula, and on tax what is bad and make sure that people can afford, what is good at the end of the day.
Well, what would you say to those who are in the industry of these unhealthy foods and beverages, who are saying, why should we be punished in terms of the levy when it comes to us and the tax when it comes to us? We also contribute to the GDP.
Right. So I think it's the nature of once you have not banned unhealthy products, you need to have mechanisms to control easy access to the population. So whether it's fossil fuel, whether it's sugary drinks, whether it's tobacco, whether it's alcohol, you need to make sure that there are mechanisms to minimize and actually to empower citizens, to make alternative choices. But I think one thing that is very, very important is that the sugar industry has been given a huge leeway with the Sugar Master Plan, for example, to look at reformulation, which from the BRICS summit. And one of the things as the Healthy Living Alliance we've been calling for is make sure that you can use the sugar cane, and the production of sugar for other alternatives, like including biofuel, which is a booming market. And countries like Brazil and India have moved. We're talking about developing nations such as South Africa, developing to middle-income countries, that we can start, not to always enforce creating demand of sugar for consumption, because we are having an epidemic that is spilling out of control. You have spoken about the number of people living with diabetes. We have more people, thousands and millions of people who are pre-diabetic at the moment, which is actually a ticking time bomb for them to actually develop diabetes. So we can't really continue in this trend of not, actually promoting health and promoting healthy living in the country of South Africa's nature. And we have seen during COVID how many people succumb to COVID and mortality rates amongst people with pre-existing conditions. And we need to drive this message home and promote healthy living in the country.
So the finance minister, when he spoke about his budget for last year, he said that he's putting a moratorium on the levy until next year. So you're saying he should actually up it by another 10% this year already, next week in fact.
So I think the biggest problem with the call that we've been calling, actually in the original proposal by Treasury when they implemented the sugary drinks tax, was actually at 20%, and that was like around 2016, and we know the tax was only implemented in 2018. It remained at 11%. Has not seen even inflation-related increases. So our concern is that this tax can easily be eroded and happen to be a tax that is redundant if it's not actually pushed in line with making sure that inflation-related increases happen, and actually we do actually benchmark it to reach to the recommended level by the World Health Organization at 20%.
And of course, the World Health Organization would know what it's talking about by encouraging this to happen. It is an organization that looks after the health of the entire nation, or the entire globe, rather. But thank you so much, Mr. Mbalati, for your time here on ENCA. Nzama Mbalati is from the Healthy